final session, which is session 13, centers on discussions on foreign body in the throat and trauma to the throat. So our objectives are that students should be able to provide immediate care for patients with foreign body in the throat and educate patients before the surgical procedures involved. Patients should be taught how to care for a wound. So the outline is as follows. We look at the definition, incidence, causes, classification, signs and symptoms, and management. Our first topic is foreign body in the throat. Foreign body in the throat occurs when an object has lodged in the throat and causes obstruction in the respiratory tract. It usually lodges in the pharynx, and common sites include the tonsils, piriform fossa, the vallecule, etc. And we have the larynx, right bronchus, and the lungs. It may also enter the esophagus and get trapped along the GIT or exit through the anal orifice. In locating a foreign body, the patient's sensations serve as a valuable guide, and if the patient points to the side of the throat to locate the discomfort, then the foreign body is or has been in that part of the throat. On the other hand, if he points to the midline, then the foreign body is probably below the level of the throat. So please once again revise the anatomy and physiology of the structures of the throat. And these are some of the reasons why foreign bodies commonly lodge in the right main bronchus. The diameter of the right main bronchus is larger than the left, and the angle of the divergence from the tracheal axis is smaller on the right. And airflow through the right lung is greater than through the left, and the carina is more likely to be located to the left of midline rather than to the right. Types of foreign body. It may be classified into organic and inorganic materials. Organic materials include food, bones, pieces of wood, gums, etc. And the inorganic ones include beads, buttons, marbles, broken parts of toys, coins, pins, etc. And predisposing factors include lack molars for proper grinding of food, lack of molars, running or playing at the time of aspiration, the attitude of keeping objects in the mouth always, and where there's lack of coordination of swallowing and glottis closure, talking whilst eating. It's common in children, especially between age 1 to 3 years, and children, especially those aged 1 to 3 years, are at risk for foreign body aspiration because of their tendency to put everything they come across in their mouth. Clinical features include choking, coughing, there's dysphagia, there's also pain at the site of obstruction, spontaneous efforts to breathe, producing a high-pitched sound during inhalation. The patient or individual is unable to speak, breathe, or cough. There may be hemoptysis, collapsing, and unconsciousness. Diagnostic investigations include bronchoscopy, laryngoscopy, that's direct or indirect suspension, chest radiography, CT scan, and fluoroscopy, barium or gastrographing swallow. The necessary intervention that can be carried out during an airway compromise include back blows, Heimlich maneuver, finger sweep. So in the picture are the interventions, a combination. This picture is a combination of 5 back blows with the flats of the hand and 5 abdominal thrusts with 2 fingers on the upper abdomen. So Heimlich maneuver was treated in Nurs 352, so you are being referred to Nurs 352. Then the management include bronchoscopic removal using a rigid or flexible bronchoscope, pharyngoscope removal, oesophagospic removal, laryngoscopic removal through direct or indirect. Tracheostomy may be performed, cricothyrotomy, thyrocotomy, and bronchotomy may all be done to remove the objects. And that is the bronchoscope being used to remove the foreign objects. That is how the bronchoscope looks like. Preoperatively, the procedure should be explained to clients, as clients will be anxious. Skin preparation may be necessary around the chin down to the neck. Feeding is restricted for 8 hours, especially if it's going to be done under general anesthesia. And removal of dental prosthesis should be done if any. All specimens should be done and collected as required and filed duly. And then post-operatively, patients should be observed for respiratory distress. Oral fluids are withheld until gag reflex returns. That is, if patient had topical or general anesthetic agents administered. There's a need to assess for complications, monitor patency of airway, and the presence of swallowing reflex. Complications include hemoptysis, pneumonia, bronchiectasis, bronchial stricture, emphysema, asphyxia, cardiac arrest, laryngeal edema, and pneumothorax. So last but not the least, we come to our final topic, and that is trauma to the throat. Trauma of the throat can occur in children and adults, and it can be life-threatening if vital structures are damaged. The patient should be treated as a case of an emergency. That is the diagram of the neck. And again, I'm entreating you to revise your anatomy and physiology of the neck and the throat. The trauma may be blunt as a result of blunt injuries, and we may have crushing injury, which may involve the larynx or trachea. Injury may lead to subcutaneous emphysema. Then we may have penetrating injuries of the throat, which can cause severe bleeding. Damage may involve airway, esophagus, and spinal cord. The management of the penetrating injuries of the throat involves the application of direct pressure to control bleeding, place an occlusive dressing on the neck wound, and then secure the dressing in place with roller gauze, adding more dressing if needed. The gauze is then wrapped around and under patient's shoulder and observed for signs of shock. Patient is observed for signs of shock, and then appropriate interventions are given if there's any sign of shock. Vital signs are monitored, and then the patient is assisted to undergo any investigations, and then also prepared for emergency surgery if indicated. The throat has important structures that support life, and a foreign body or trauma to the throat can therefore be life-threatening. Therefore, effort should be made to ensure the life of the patient is saved. Next, 334, which is the general surgical nursing management of a patient with nervous or neurological, musculoskeletal, and sensory neural organs, involves providing care. First of all, identifying various conditions of these systems and providing pre- and post-operative as well as general care to patients with these conditions. Students are being entreated to have clinical experiences at the orthopedic wards, neuro wards, as well as the eye, ear, nose, and throat units or ward, and then be able to manage patients with conditions of the neurological, musculoskeletal, and the sensory neural organs. Thank you, and I wish you all the best.